Hello everybody, it's Peter Beresford again, long time no see, from Shaping Our Lives, the National User Network and User Controlled Organisation. Today I want to talk a bit about the future of social care and particularly the future of social care funding, and that's coming after the election when we know that the Conservative government under Mrs May had put a big emphasis on social care funding, and it seems by all accounts that the suggestions, proposals she offered have had a disastrous effect on her party at the ballot box. That's to say, people did not like the proposals she offered, and people have called her proposals for the future of social care funding a death tax and particularly a dementia tax. And what she talked about doing in a very simplistic way was that, oh yes, you will not have to leave your house if you need social care support until you die. So you won't notice anything, then you die, and then up to leaving only £100,000, and we know that now in this country housing is so expensive that will take a very large amount of money from people who've got houses. You will then have to pay that back, or your family will, after your death. So you will effectively lose that money. Now, there's been no clarity about this. There's been no clear talk about, say you were a couple, what about the other person? Say you have children who are grown up who live there, what about them? None of this has been discussed, nor has there been any discussion about will they treat the money you're, as it were, borrowing on your house as a loan and charge you interest. What she did do, though, was she said there would be a cap, although she wouldn't say how much on what you would pay. But still people didn't like it. And what I want to try and do today, briefly, from Shaping Our Lives perspectives, from the consultations we've carried out with other people who are disabled and service users, and our research, say what it seems to us a good future for social care funding would be. Now let's get this straight. At the moment, if you need social care support, then you are going to be needs and means tested. That's to say, they will check how much money you've got, and if you've got more than a certain amount, you'll have to pay for it. And because there's been less and less money with austerity cuts, fewer and fewer people have qualified as having the needs to be entitled to state social care. I don't think most people realise that NHS support, which is free at the point of delivery still by and large, that's not at all how it is with social care. You are likely to have to pay. And the other thing, which of course Mrs May was going to do, was to extend that you paid right out of your home, not only for residential care, but also for care at home. Basically, social care's funding system of entitling a smaller and smaller number of people to support, and free support at that, is nothing so much as like the old poor law that everyone was frightened of. It hasn't really been improved by the welfare state. Now, when the welfare state came into existence, what happened was that now for the first time people were entitled, not as an act of charity if they were lucky, but everybody, to free healthcare from the National Health Service. You needed help, you got it. You paid for it out of taxes, out of general taxation, like you pay for lots of other things. You didn't have to pay for it from some special local tax, from something like council tax or any add-ons or additional bits of tax. You just paid for it and you got it. And what service users are saying more and more is that's how social care should be. You shouldn't have to pay for it, and it should be paid for by all of us together, sharing the risk out of general taxes, general taxation. Not putting them up, but making sure that organisations, corporations and rich people who haven't been paying so much tax pay their fair share in future. And not only will that for the first time make it possible to get rid of all the conflicts and competition and lack of fit between health and social care, but it will mean that everyone, not just older people, but everyone of working age, including children, everyone has access to good support, social support, which as our population changes, and there are more and more very old people and older people, and people who are adults who are disabled, who haven't died, and disabled children, and families bringing up disabled children, and families who are themselves disabled bringing up children, that all of them will get as entitlement, as part of the civilised way of thinking about us as citizens, health and social care, not split up anymore, but as one thing. That's what we believe in Shaping Our Lives. That's the only workable, sustainable system that will stop things getting worse, that will make it so that people don't have to get iller to get any help, get more impaired to get any help. Not only that, but it means at last we can have social care on a sustainable footing with the workers in social care, who are so important, properly paid, with careers, with training, with support, and no more 0-hour contracts, no more 15-minute visits and getting paid nothing while you're travelling. So that's the future. We want a social care system that's fully and equally part of the NHS, both free at the point of delivery, which we all of us contribute to as we're living our lives through the taxes we pay. Thank you ever so much. I hope that's been helpful.